And our presenter this afternoon is on the top left-hand corner of my screen is Elaine Power, who is a professor at Queen's University. It's kinesiology and health, and I really like the emphasis on the health part because this is health in the broadest sense of it. And I know that she has been engaged, involved, and working on concerns about food security for a number of years. And so her insights and perceptions are going to be particularly valuable, especially for us today, and especially the solution that she's going to talk about. Well, not the solution, but at least the option to mitigate some of these concerns that she's going to talk about today. So thank you, Elaine, for being with us.
Thank you so much, Ken. Thank you for that introduction. And yes, I'm definitely in the health studies part of the School of Kinesiology and Health Studies. I know a little bit more about kinesiology than I did when I started almost 20 years ago, but don't ask me about kinesiology. Anyway, I'm delighted to be here to join you today, and I have a slide presentation. I think Ken is going to keep an eye on the questions. So if people have questions during the presentation, sometimes it's not as easy in Zoom land as it is in person. But if you have a question, or raise either your physical hand or your electronic hand and want to interrupt me, I'm happy to take questions as we go along. And I'm really grateful for the opportunity to talk about the two things that I care about so much: food security and food insecurity. The solution, as I see it, to food insecurity, which is basic income. And I've been doing advocacy work now for about 10 years on basic income. In fact, was just in Hamilton yesterday for an event on basic income that was really inspiring. But I'm going to start by sharing my screen. And you'll see my title is Making Room at the Table. And I really appreciate the theme of your gathering today of hospitality and bringing everyone in. And I think there's a growing consensus that a guaranteed livable basic income could really make a significant dent in hunger and food insecurity. And of course, we know that the rates of food insecurity have gone through the roof over the last year. Before I begin, I would just like to acknowledge, as you are in Toronto, I'm in the Dish with One Spoon Wampum Belt Treaty territory, which was and is an agreement between the Anishinaabe and the Haudenosaunee to share the land, to protect it, and to ensure that everyone has what they need for survival, including food now and in the future. And I think this image of the bowl, the dish with one spoon, is such a fitting image for this work. In particular, the idea that the bowl is the land, and there's only one, and we share it peacefully with a spoon. Let me just see here. And then I'll jump into my talk for today. But back last month, actually in September, Food Banks Canada issued its very first poverty report card. And I'm really happy to see that Food Banks Canada is becoming more political and talking more about the root cause of food insecurity, which is poverty. The highest grade in the country was Quebec, and it was only a B-. Ontario got a D-, and you can see that there are a number of measures that they were looking at. I think we could probably challenge them on some of these measures, actually. I don't really know why they got a D-. So if we look at the poverty measures, for example, we can see that the poverty rate for Ontario is listed at 7.7%. Social assistance as a percent of that poverty line was 34% for singles, disability 54%, And then we see the food insecurity rate at 19.2%, which I know is really accurate. And what we know about the way food insecurity is measured is that it's actually the experience of households. And so when I see that 19.2%, which was for 2022, and I compare that to what the market basket measure of poverty at 7.7%, I have to think that there's a problem with the market basket measure, because we know that food insecurity is a very sensitive indicator of material deprivation. And if it doesn't make any sense to me that we'd say that the poverty rate is 7.7%, and yet almost 1 in 5 or 20% of households can't put food on the table or really worried about putting food on the table. And I have no idea how Food Banks Canada came up with a C- when 1 in 5 households in Ontario is food insecure. Maybe that's relative to other provinces, I don't know. But to me, that's for sure a failing grade. And just to say as well, we'll come to it again later, but this is the highest recorded rate of food insecurity in Canada, in Ontario, but also nationally, the rates have really just gone through the roof. Let's see, this was from last year's hunger count, when we had almost 1.5 million visits to food banks in March 2022, which was an increase from the year before and 35% higher than 2019. The subtitle on the report was From a Storm to a Hurricane, because of this trifecta of high demand, declining donations, and the decreased purchasing power because food was so much more expensive. And last year, Food Banks Canada said, we're fearful of what lies ahead. Well, they had good reason to be fearful. They just this week released their 2023 hunger count. This is based on the numbers of people using food banks in March. And again, this is March 2023, probably it's even higher now, but 32% increase from 2022. And the top 3 reasons for people using it is food costs, housing costs, and low wages or not enough work. And so one of the things that Food Banks Canada has really emphasized is the numbers of working people with full-time jobs who are using the food bank, and many food banks are opening up now, during the evenings and on the weekends, so that people can use their services. The other thing that's really striking to me, this after, we've had more than 40 years of food banks in this country, and for the first time ever, to my knowledge, the Food Banks Canada is really asking for people to write to their MPs and encouraging people to be involved in political action to address the root cause of this crisis. Here's some of the words that are being used, some of the adjectives that are being used to describe the current situation. This is both from the hunger count report itself and some of the media reports. Unprecedented, heartbreaking, record-breaking, unsustainable, explosive growth, grim, terrifying, people scrambling, including the food banks, running out of food, skyrocketing costs, exploding demand, never before, turning people away, alarm bells are ringing, full-fledged crisis on the tip of the iceberg. And I think, I'm sure some of you probably are involved in volunteering or running food banks, and I expect this is probably your experience as well. So the report that just came out, the recommendations are having an income floor for all. To my way of thinking, that's the same thing as calling for a basic income, making sure that everyone has a floor underneath them that enables them to meet their basic needs. Getting serious about affordable housing and better supports for workers. And as I say, this is the first time that I know of that they have on their website this place where you can click and send a letter to your MP. We know that food insecurity is a really serious public health problem. It's very sensitive to changes in income, and so for that reason, I know Valterrasak at the University of Toronto was instrumental in getting markers of food insecurity added to the poverty reduction, the federal poverty reduction strategy. It's measured by an 18-item questionnaire, and the data that we have is from nationally representative surveys. So it's actually a much better indicator of food insecurity than food bank use. And I accidentally skipped this slide, but this shows, I mean, food bank use is maybe the most visible marker of hunger and food insecurity in Canada. But what we know from surveys is that probably only about 1 in 4 or 1 in 5 people who are, objectively classified as food insecure actually ever go to a food bank. So if we have 2 million people using food banks in March of 2023, that means there's probably somewhere in the neighborhood of at least 8 million Canadians who are food insecure. So over time, we see this relationship of, like I say, 1 to 5, 1 to 4 is fairly consistent. So although it's a visible marker, it's not, it's just the tip of the iceberg. So if we look at the statistical data that we have, this is this is for 2022. We can see a national rate of 18.4% of Canadians. This is only provincial data. It doesn't include the territories where we know the rates of food insecurity are much, much higher. So again, we can see Quebec having the lowest rate. Ontario just a little bit above the national average. The Maritime, the Atlantic provinces, pretty high, and even Alberta, which is this should be a national disgrace. We have 1 in 5 households living that are food insecure, and 1 in 4 children. This in one of the richest countries in the world, and in one of the richest countries in history. So that amounts to about 7 million people, almost 2 million children, and in Ontario, almost 3 million people. And these are undoubtedly underestimates because it is a survey measure. It doesn't include people who aren't able to respond to the survey, like people who are unhoused, for example. Yeah, so if we look at the people who are most likely to be food insecure, we can see that Black people, almost 40%, Indigenous populations, these are off reserve. In some reserve communities in Canada, the rate of food insecurity is been measured at 70 to 80%. And you can see that most racialized groups have higher rates of, well, all racialized groups, and only if you're not a visible minority or Indigenous, if you're white, then your rate of food insecurity is a bit lower, or your risk of food insecurity. Other groups who are more likely to be food insecure include anyone living on social assistance or employment insurance, any children, households with children, especially households where there's a lone parent, and especially a lone mother. People living alone, and particularly adults living alone, are more likely to be food insecure than people who rent. If we look at the health consequences of food insecurity, it's actually pretty devastating. It doesn't really matter what you look at. I think the only exception really is cancer, but almost everything else is much more likely to have poor rated self-rated health, poor mental, physical, and dental health, almost any chronic condition, from diabetes, heart disease. We know that depression is about 3.5 to 5 times higher, back problems. And of course, for any of these conditions that require management through food, like diabetes or heart disease, we know that people are much less able to do that because healthier food costs more. We also see for mothers and children, in pregnant women, we see that there's impaired fetal growth and development. There's poorer birth outcomes. There's higher rates of birth defects. In children, we know that they have poorer overall health, higher rates of hospitalization, iron deficiency anemia, asthma, developmental problems, behavioral problems. And the mental health consequences are profound. So we see in teenagers in particular higher rates of depression, and it seems that even if for children, if they've experienced food insecurity at some point in their childhood, even as young adults, they're much more likely to be depressed and have suicide ideation and suicide attempts. So this is really serious public health problem. We can see the seriousness of that reflected in healthcare costs. Almost all of this research that I'm describing, not all, but much of it is out of Dr. Valerie Tarasuk's group, research group at the University of Toronto called Proof. This is a very powerful illustration of the cost, just the economic cost of food insecurity. And so you'll see here that food insecurity is categorized by degree of severity, from marginal to moderate to severe. And as that food insecurity worsens, you see that the healthcare costs go up. And that the fact that there's such a tight correlation between the severity of the condition and the cost suggests that this is a real thing. It's not a statistical artifact. And of course, it makes sense to us. So this was published in 2015. So it's about 10 years old now. And we would imagine that these costs have only gone up, but we would expect the relationship to be pretty much the same. And you see the same kind of relationship with whatever you look at, that as food insecurity worsens, the condition also gets worse. And we see the same thing even with premature death. So as food insecurity worsens, people have a higher risk of dying earlier. So again, like I say, this is a very severe and troubling problem. We know that people who are adults who are living in food insecure households are more likely to delay, reduce, or skip their prescription medication because of the cost. We know that food insecure households are more likely to have poorer quality diet. They're more likely to be behind in payments for things like phone and internet, utilities, and rent. And their living conditions are often worse. So the food insecurity, much as the food banks are a tip of the iceberg, food insecurity is also a tip of the iceberg in terms of the condition in which people are living. And we know, again, from multiple research studies that when low-income households get more money, the food insecurity improves. So this could be improvements to social assistance benefits. It could be improvements to Canada Child Benefit. It could be higher minimum wages or lower tax rates. A couple of the people in Val's research group did this beautiful study looking at people in the lowest income decile, so the lowest 10% of income earners. So these would be probably people on social assistance from age 60 to 64 compared to 65 when they get the old age security and the GIS. The rate of food insecurity halves when people turn 65 and they start getting the old age security, which is a basic income. So again and again, we see that it doesn't really matter where the income comes from. Once households get more money, they're more likely to be food secure. So that has led me, I've been doing research on food insecurity for about 30 years now, and it's led me to become an advocate for basic income. And when I first started doing basic income advocacy, I thought, this is such a no-brainer that surely we'll have basic income within a few years. That was 2013. 10 years later, I'm kind of settled in for the long haul. One of the other members of our group, said to me probably 8 years ago, he said, I'll be lucky to see basic income in my lifetime. And I was kind of in shock. But I realize now that he was right. It's going to take a lot more work than just having the evidence to show that it's effective. So basic income, people throw that term around quite a lot these days. We'll talk a little bit more about what kinds of basic incomes there are, but the kind of basic income that the basic income movement that I'm part of in Canada, which includes the groups that you see on the screen here, the Basic Income Canada Network, a group called Coalition Canada, UBI Works, and the Basic Income Canada Youth Network. I think we're all agreed that we want basic income that would be targeted to lower income people, not universally given to everybody, but targeted to those who fall below a certain threshold. That it would be unconditional, so you don't need to behave a particular way. You don't have to, spend all your savings. It's just about income. You meet that income test and you get the cash. It would just like CERB. You qualify, you get the money in your bank account, and it would be a cash transfer from government to whether it may be individuals, maybe to households that or families that would, again, depends a bit on the details, but it would enable everyone in combination with robust social services to meet their basic needs, to participate in society, and to live with dignity, regardless of their work status. You don't have to be looking for work. Maybe you have a few part-time jobs. Maybe you're working, volunteer work. So it's just a right of citizenship. And so that's the kind of basic income that we're advocating. There's two main varieties, and we've heard a lot since the pandemic about UBI, or universal basic income, and that's it's also called the Demogrant model, where everybody gets a payment. So Andrew Yang in the 2020 presidential or the election was advocating $1,000 for everybody. And so everybody gets the same amount. And then the idea is that you tax it back from those who have higher incomes. That might be a good idea if we had a more progressive income tax system. We know that higher income folks have lots of ways of not paying their taxes. We also know that the cost of Basic Income Canada Network has actually costed a Demogrant model, and the upfront costs would be astronomical and probably politically not feasible. We're talking about universality in the sense that, like we talk about Medicare, that if you need healthcare, it's available to you for no cost. And so our idea of universality is that it's universally available to everyone who needs it. The issue, you'll see lots of UBI pilots happening in the States right now, in the US, but they're not livable. They're usually a few $100s a month, up to, I think, about 1,000, but you can't live on those. And so the kind of basic income that we're advocating for would be a livable basic income. And so I think that many people are now starting to use that term instead of just basic income, that it's a guaranteed livable basic income, also known as a negative income tax. So the idea that rather than paying income tax, the government pays you. So once you fall below a certain threshold. So this idea of a basic income is that it's an income floor that eliminates the risk of falling into poverty, enables people to meet their basic needs. It's available to everyone, but you'd have to meet a certain income threshold. There's also kind of three models, and this is, you'll often, I think in our 10 years of doing advocacy, we've been surprised at the lack of support among some on the left. And that's because there is a libertarian model of basic income that provides a very low benefit level and kind of basically strips away what's left of the social welfare, the social safety net. Milton Friedman, for example, who is a right-wing economist, was an advocate of basic income. And so people will say, well, if Milton Friedman supported basic income, then, how can I support it? So that's not the kind of basic income we want. The second model is what's called a mixed welfare model, conditional benefit, partial and conditional. I would put CERB in this case. So it was a conditional basic income. It was conditional on having earned $5,000 in the previous year. And of course, it was a temporary basic income. So again, not exactly what we wanted, but in the kind of, at least in terms of the dollar amount, was in the range of what we wanted. And then the kind that we want is what's called a strong model. So strongly universally available to everyone who needs it. You don't have to have earned income in the past. Yeah, as I mentioned, unconditional, able to meet basic needs, and integrate it with other social programs. So it's really important. It's not like there's a basic income program sitting on a shelf somewhere that we can just take it off the shelf and plug it in. The details would need to be negotiated and worked out. So it's not like there's not just one basic income program. And so that's really important to think about. What we're starting to see over the last year is that governments are reforming disability programs, disability support programs, and calling them a basic income. And we would say that's not the kind of basic income we're talking about. But we do have some examples. As I already mentioned, the OAS and GIS, to some extent the Canada Child Benefit, although no one could live on the amounts, but it does provide, it's a it's people at the lowest end receive the highest benefits. I think it could be better targeted to make sure no child in this country lives in poverty. And not everybody in the basic income movement agrees that CERB was a basic income. I think it was, but not the kind we want, but conditional and temporary. We also had two pilots in Canada. The MINCOM pilot, which many of you may know about, which was in Manitoba in the 1970s. And I can talk more about that if people are interested. But it was very much informed the develop of the Ontario Basic Income Pilot, which was announced by Kathleen Wynne in the 2016 budget, began to roll out in 2017, and was abruptly and I would say unethically canceled by the Doug Ford government at the end of July in 2018, just a little more than a few weeks after he was elected, even though he promised to maintain the pilot. So it was about, there'd only been baseline data collected, it was supposed to run for 3 years, so it was less than a year. Although the benefits continued for 9 months, but there was only about a year that most people were on it before it was canceled. I have a quote there from Dr. Danielle Martin, who quipped that if we could find a drug that reduced hospital admissions by 8.5%, we'd be putting it in the water. And this is the 8.5% comes from data that Dr. Evelyn Forget analyzed from the MINCOM pilot, and found, even though it was pretty short term, 4 years, that hospital admissions were reduced by 8.5%, particularly for accidents and injuries, and also mental health. So there's Kathleen Wynne making the announcement about the Ontario Basic Income Pilot. Hugh Segal, former Senator Hugh Segal, who unfortunately died just this past August, put together the model for that pilot. Hugh is a lifelong advocate for a guaranteed basic income, and Kathleen Wynne made an arrangement with him to develop the model. He agreed to do it on condition that he not be paid. Anyway, we really miss Hugh, and his wisdom and his words stay with us, but it was a big loss when he died. So there were 4,000 households, 1,000 in Hamilton, 1,000 in Thunder Bay, and 2,000 in Lindsay, Ontario, which was meant to be what was called a saturation site, where most people who were eligible for the pilot were signed up. It, as I say, it was supposed to run 3 years. There were also 2,000 people who were signed up to be in the control, so that we could look at these two groups and compare them and say that the effect was actually related to the pilot and not something else. There was a very robust evaluation plan, and part of, I mean, when I stop and think about the cancellation, I sometimes think I could still self-combust in rage, because it threw the lives of 4,000 people up into chaos. And it also destroyed our ability to have all this data that could inform our conversations now about basic income. And I know that was deliberate. So the evaluation plan included things like healthcare usage, mental health, food security, housing, education and training, employment, and labor market participation. So if the pilot had been allowed to run as Doug Ford promised it would be, we would have all that data now. Instead, we have data from at the beginning, although that was destroyed under Doug Ford's order. We had this is Lisa MacLeod, who's the minister responsible at the time, who made the announcement. Her staff, actually, she was relatively new in the job at the time, and they didn't do a good job at the press conference, kind of positioning her in front of her sign. You see that in the background there, live in poverty, and I think that's the people who were affected by the cancellation felt like that's what Lisa MacLeod was telling them. It's like, go live in poverty. The sign actually said 1 in like 7, I think, Ontarians live in poverty. And our premier suggested that, you know, people should get a job, not basic income. And of course, we know that 70% of people who live in poverty actually do have a job. We also know that many people, for many people, jobs they can't manage a full-time job. And so, anyway, we can talk more about that. We also know there's also a lot of work that gets done that holds communities and families together that's never paid. So we would argue that basic income is a way of recognizing that work. What we do have is some qualitative and anecdotal evidence. Actually, I was in Hamilton yesterday, and there's actually been a new study just released that again supports all of this. It gets kind of boring after a while, quite honestly, because there's never been a research study anywhere in the world, and there's quite a mountain of it now, that has ever shown anything other than a positive effect of a basic income. And even the ones in the US that are happening right now that are much smaller amounts of money, they're showing very similar results. So better health. I remember being in Hamilton, listening to people talk about the impact of people who were on the pilot, talk about the impact, and not waking up in the middle of the night in a panic attack, wondering, you know, how they were going to pay the rent and put food on the table. People who went to the doctor frequently didn't have to go so often. They stopped the medication. You know, thin people gained weight, and fat people lost weight. People were more able to be engaged with their family and friends, their community. I remember one woman who was in her early 60s when she went on the pilot, and talked about, you know, the first thing she did was to get new glasses, and the second thing was to get a new walker. She had one of those, you know, fancy walkers that you could sit on. And she said that the third thing she did was to give a donation to the community organization that had supported her for years through many crises. And she was just, it gave her so much pride and dignity to be able to give some money to that community group. People got better housing. Many people decided they would return to some kind of education or training program. people who were employed got better jobs, they paid off debt, they were able to eat better, and really just having a life. Listening to these stories, I still get really emotional thinking about the incredibly positive impact that this had. And I should say, actually, so for a single person, the Ontario Basic Income pilot gave a single person approximately it was approximately $17,000 a year, which was about double OW, Ontario Works, at the time. It was still only 75% of the poverty line. So it was set at 75% to create some incentive for people to, get some part-time work. That's one of the things about basic income that's different about social assistance, is that, you can, the clawback rate isn't as dramatic. So people could work and supplement their basic income, and it would just gradually taper down. So $17,000 a year is still not a huge amount of money, but it's kind of astonishing to me to think about the incredible benefits, even though it was still below the poverty line, the official poverty line at the time. On the left, as I say, we've been really kind of surprised and very disappointed at some of the arguments on the left. The NDP we haven't seen big uptake of the idea from the NDP, which we've been shocked and disappointed. John Clark, whom many of you would know, who was formerly the head of the Ontario Coalition Against Poverty, talked about basic income as a Trojan horse that would eliminate what was left of the social safety net. I think he was thinking of a Milton Friedman type basic income. Also, the idea that John would also talk about it being a subsidy to low-wage employers. And I think that's true with what's happening in the US. If you're giving someone $300 or $400 a month on top of what they're earning at sometimes 2 full-time jobs, that is definitely subsidizing low-wage employers. That's not the kind of basic income we've been talking about. Many on the left think we could have, they set up this either or. We could have basic income or we could have social programs. And those of us in the basic income movement are saying, no, that's not what we want either. We want both. We want basic income, and we want childcare, and we want pharmacare, and we want affordable and rent geared income housing. And then we can afford it all. And often the cost of basic income is not weighed against the benefits. We know that poverty is already costing us probably in the neighborhood of $80 billion a year. So over time, this program would pay for itself. We understand basic income to be really a floor and a central pillar of a renewed social safety net. And of course, the unions, there's a lot of diversity in the unions, but some are arguing that, they would lose members. Well, in my world of basic income, and I think many in the movement, the people who are employed now to police people on social assistance could be put to work to do much more probably interesting to them and more useful work that would actually assist people to fulfill their own dreams. So there's lots of work. There's lots of work in the social service sector that could be done, whether that's mental health, literacy, addictions. There's lots of work that could be done. I see there's something in the chat. Oh, sorry. Okay. On the right, of course, the main arguments are that we can't afford it. And of course, that's a political decision. As you say, we're already paying a huge amount of money for poverty. It's invisible for the most part, but it's a huge amount of money. And of course, we can afford it. We can apparently afford to buy pipelines and lots of other things. And certainly the experience of CERB showed us that when there's the political will, it's kind of amazing what we can do. It's a disincentive to work. that, you know, you give people money for nothing and they're going to sit at home and play video games and I don't know, like watch soap operas. There's no empirical evidence of that. None of the research shows that. And I suppose I think the arguments on the right are, you know, obviously ideological and maybe kind of reflect your idea of basic human nature. And I don't know what will change anyone's mind. Quite honestly, it's certainly not data. I do have just some, I've been working with a doctoral student, Chloe Halpenny, who's the chair of the Basic Income, co-chair of the Basic Income Canada Youth Network. And we've been going back to look at some interviews with people who were on the pilot and we have just some preliminary results, but again, they're pretty much what we would expect about what happened to their food and eating practices when they were on the pilot. So right away, people talked about you know, how much better their food security was. They were able to stop using food banks, and it was reduced their stress and anxiety. People talked a lot about how the dignity that being on basic income gave them, about food and other things as well. So, you know, a couple of quotes there. It helps with your emotional, your mental well-being because you're not stressing that if you spend a little extra on food that you're going to be broke. And so another person said we were eating fuller meals at dinner time. No one was going hungry at any point, and we had constant snacks in the cupboard. People talked about the improvement to their health, you know, to nourishing their body, the better quality of food that they could buy, fresher and more nutritious food. And some people felt so much better and thought that was in large part related to being able to eat better. And again, a couple of quotes. I didn't have to have my calculator open to see if I could make it to the dairy fridge at the end of the store before I ran out of money. If I wanted a cauliflower, I could have a cauliflower. You can't do that on ODSP. On ODSP, you eat bread, pasta, rice, all the cheap and cheerful carbs that you can because you've got to get filled up and you've got to do it as cheaply as possible. It changed the way I interact with the world. Then another quote, it makes no sense. One of the things doctors tell you is to eat right, rest, no stress, and exercise. And except for the exercise portion, everything else is related to income in some way, shape, or form. It's almost as if you're non-compliant if you're living in poverty. People talked about the ways it enhanced their social health, their social nourishment and social connection, their ability to be more involved in social activities, to be friends with people. They were less isolated. They had stronger relationships, greater sense of belonging. And so this, you know, again, you can see some of the quotes. I was struck in doing some of these interviews myself by how happy people were to be able to support local initiatives, you know, like the farmers market and the local grocery stores, rather than just always looking for the cheapest thing. This last quote, it made our family closer because I felt I was more able to talk with them. I was always afraid of talking with them, that I'd be saying, no, I'm out of food, I'm out of money. I didn't want to complain. When I was on basic income, we just had conversations and food and transportation never came up. So again, that idea of just having a life. This other person says, you know, I was happier when my kids would come with their grandkids. I could put a meal on the table and sit down and have a family meal on a Sunday with my children and grandchildren and have a little treat in the house for them. Just that alone brought pleasure. So again, you can see the profound impact that this, even though it was below the poverty line, it made such a difference in people's lives. And people felt that they were just better able to meet their social obligations. You know, I could go spend a week with my daughter and be a contributing member, bringing my own food, not taking from her. For a long time, when the kids came to visit, they'd have to bring the snacks because I don't have them. As a nana, that really bites because we're supposed to. And there's someone else talking about going to the farmer's market. And then just food is pleasure, the things that we take for granted when we have adequate income, of just being able to go out and try new foods, not feeling like you're going to waste money if you or your children don't like it. Or this second quote, I could say, you know what, let's go to walk down the street and get ice cream. It was nice to be able to do that. And yeah, just buying things because you like how they taste. So I'm going to wrap up shortly, but this was that's the cover of a book that I wrote with Jamie Swift, that's available from Between the Lines Press if anyone's interested. It describes the experiences of some of the people on the pilot and kind of talks about the impact on the communities, Hamilton and Lindsay in particular. So yeah, it's written in a pretty accessible style, I think. And we often, as someone who talks about this regularly in food insecurity, sometimes people will say, well, those poor people, those food insecure people, they just need to learn how to budget, or they just need to learn how to cook. And I think what these data show very clearly is that that's false. That it's not a problem of knowledge or skills, that it's really an income problem, and people were delighted to buy better food when they could. So where do we stand now? I think the biggest thing of this month is that the Senate Finance Committee had hearings last week, actually, about a bill S233, which was introduced into the Senate that would have the government develop a national framework for basic income. And there's been kind of a flurry of activity around basic income because of that. Lots in the media in the last week or two, which you may have seen. We do have some lessons from CERB, I think. We also have, as I mentioned, lots of municipal governments. I think there have been 30 endorsements just mostly in the past year. There's lots of support for this. So I guess, as you say, I'm kind of settled in for the long run, but the good news is that I think basic income has certainly become more mainstream and more quote unquote common sense. I think Mike Harris maybe ruined that term, but there seems to be a lot of public support for basic income. Lots happening provincially, particularly around PEI. There's a proposal that's been developed for a demonstration project for the whole island, which could be like Medicare. Saskatchewan kind of did it first, and then it rolled out across the country. We're hoping that PEI will be the equivalent in Canada for basic income. And there's a few photos of our local group. I think there's still lots of questions remaining, and especially around, what will it take? What will it take to get politicians to listen? Certainly, the evidence isn't convincing them, because we have a mountain of evidence now. I think there's still a lot of pernicious stereotypes about people who live in poverty, and Hugh Segal used to talk about that quite a lot. The kind of Victorian idea that people are it's some kind of moral flaw, and that people are responsible for their own poverty, and so they need to be punished somehow. I think I don't know what it takes to change that. It feels close, and yet we're not there yet. So I think it's going to take a lot more public pressure to address some of these really urgent, really pressing problems of poverty, of food insecurity, of homelessness, and lack of affordability. So with that, I think that's it. I'm finished, and I'd be happy to take questions from people.